Okay, good afternoon, Mr. Pearsall. Thanks for joining us today.
Hi, Dr. Sekula. My delight to be with you.
So maybe share with us why you're here. We asked you to share your story.
Well, why I'm here is that you, from my point of view, probably saved my life with the condition that I was in. But that goes back all the way to 2017 early, when I had a glossopharyngeal shock in my throat. I was in a little banquet environment, and it stunned me, and I thought, oh my goodness, what is this? And that lasted for maybe 5 or 10 seconds. And from that point on, periodically, usually like once a year, I would get these similar attacks, each time being more severe. And I would kind of nurse things along, like swallow from the other side of my throat to, be careful how I was eating and that sort of thing. But in the early stages, I went to an ENT doctor who did a lot of testing with me, tubes down my throat, trying to find what was wrong with my throat. And eventually he got to the point where he was pretty sure that I had Glossopharyngeal Neuralgia. And so from that point on, every time this would happen, and it would happen usually once a year, sometimes twice a year, I knew what I had, but I didn't know that it was going to go to the point where I was when I met with you a month or so ago. So, which was the most excruciating, difficult, debilitating thing that I can imagine anybody ever having. I've talked to people on a 10 scale, the worst pain you've ever had, and I would put this at a 15. So it was just horrendous. And I lived with that, but I wasn't going to be able to live with it much longer. So my son somehow, some way, found his way to you.
He emailed me on a Saturday morning.
Is that right? Well, it was amazing, and he must have done his homework. I know he made some phone calls. So that weekend, or that Sunday or Monday of that week.
Yes, he emailed me on a Saturday morning. I was at a cross-country meet, and I called him, and we had a good conversation, and he made some plans to bring you to New York.
Well, and that's how it played out. So on Monday, he said, I can get you help, and you need to get to New York. And at that point, we were thinking maybe we need to find a way to Mayo Clinic or Cleveland Clinic. We didn't know. We weren't getting any help locally. And so I had an appointment with my primary physician on a Tuesday. So our son had shared all that with us either Sunday or Monday. And he said, you just need to get here. So when we met with our primary physician, when we laid out the plan and what our son and you had developed, he said, absolutely, you're going to the right person, because we had information on you and your success and experience already that we were able to share with him. And he said, my biggest concern is if you can just get there, because he knew how bad I was. So our son made plane reservations that afternoon, and we were on a plane at 6 o'clock in the morning out of Traverse City the next day, which was Wednesday, the 5th of October. And I probably drank 2 bottles of lidocaine just to numb it up and try to get me from here to there. And we made our appointment with you at 11 o'clock on the 6th of October. You had an MRI that wasn't at the quality level that you're used to seeing, but there was enough there for you to be convinced that it was exactly that and what needed to be done to fix it. So miracle number 2 or 3, you and your team get me into the Columbia University Presbyterian Hospital System ER, and I get pushed through that where there are thousands of people in there with me, and amazingly, at somewhere shortly after 4 o'clock that afternoon, I'm in pre-op with your preparing, and you dropped everything, by the way. That's just it's all of this is largely unimaginable for me that could happen. That, first of all, without a doubt, the most renowned number one surgeon in the country for this very rare condition, for me to have access to that person, you, and then for you to drop everything because you had other commitments that were setting right before you, including a trip to San Francisco and everything else. And you saw me, you saw what it was, and you and your team caucus for a few moments, and you said, we got to do this. And you made it happen. And then you go in there, and after sharing with us, all the pluses and minuses, the risks and all that, what the procedure is going to be and so on. And you went in there and found not one blood vessel on this glossopharyngeal nerve, glossopharyngeal nerve, but two. And you did your thing and moved them, as you described to me recently, up out of the way, and they're never going to be leaning on that glossopharyngeal nerve again. And I thank God and I thank you. And it's just it's an amazing story. I'm going to write a story about it, but that's your Reader's Digest version of all of that.
Well, I appreciate it. What we found there was the posterior inferior cerebellar arteries, which is one of the main arteries for the brainstem and back of the brain. And that was compressing the nerve in a characteristic position. It was quite adherent to the nerve, but we were able to separate that nicely. And I remember seeing you immediately in the postoperative holding area, and you were able to drink and eat, and you hadn't been able to do that before. So I knew we were in good shape.
Yep. That debilitating right at the end, particularly when you had, and I have such a passion for this and for you and for your team and what you've done for me, but there are not a lot of us out there. I think the odds are like maybe there's a couple thousand people in the country that even have this, but for those that have it, if I can do anything to help them get fixed and help from people like you, because it's such a debilitating condition to be in, and to know that there is a solution out there. Because if I'd have known what I know now, I would have addressed this way before it got to the last stage, because it's horrible. So anybody that has knowledge that they might have something or do have something like this, I would do anything I could to make sure that this or any other form of media would be available for them to get help, because it's a horrible thing to have.
Yeah. Well, thanks for sharing your story today, and we'll stay in touch.
Good.
Okay.
You're welcome. Thank you. And thank you again to your team and Caroline and Ribby and everybody else. So thank you.
Okay. You have a great day.